Jackson, and I'm a student physical therapist assistant with Jeff State, and today we will be reviewing a treatment plan for a patient. He is a 40-year-old male who was diagnosed with a herniated disc of L5 and S1. A herniated disc is where the disc in between the intervertebral column in the spine, it protrudes out, and it protruding alone doesn't cause the pain. What actually causes the pain is when that disc pushes up against a nerve root, and that pain can also sometimes result in radicular pain, which our patient has been complaining of as well on the posterior side of his right leg. He also has a history of bilateral knee medial meniscectomies, which took place 5 and 10 years ago. Okay, a little bit more about our patient is that he was complaining about not only the low back pain, but also symptoms when he attempted to climb 12 stairs that he has at home. So that is also something that we want to focus on. And we found when observing him that he only has 50% of normal flexion, and once he gets to that point, he also experiences the symptoms of the low back pain more intensively. And we also found that when he attempts to lift objects from the floor to waist level, that he bends with his spine instead of using his legs. So that'll be another area that we'll focus on. I chose to use soft tissue mobilization on the patient, and more specifically to use longitudinal to increase mobility of the connective tissue of the IT band. Once we can increase the mobility of the IT band, what that will do, if it's really tight, it will allow the patella to track properly. And if the patella can have more mobility in tracking, then that will increase the ability for the patient to be able to flex the knee, which will help when walking upstairs and also when bending to pick objects up off of the floor. So this coincides with the subjective and objective findings that we stated previously. So just to demonstrate that, my makeshift massage cream. So we just want to do, just make sure you have enough cream on that area. And just massage the IT band, feeling to see if it's tight, and to loosen it up and get more mobility in that area. Like so. Okay, so I also educated the patient on proper lifting techniques. This was very important for him because he does a lot of lifting while he's at work. So he was advised that when lifting, to bend with the knees and to keep a flat back or a neutral spine, and to keep the object as close to your body as possible, and to bend like so when lifting. And that will be the safest thing to do to protect his back. And that's also utilizing that knee flexion, and that's why that's something that we're working on in treatment, so he can have those good body mechanics. Okay, lastly, the patient was taught a home exercise to help with the knee flexors and the hamstrings. And what I chose to do was just hamstring curls. And that's what I chose because it's easy to do at home. You really don't need any equipment. All you need is a chair to stabilize. Since this is something new we're working on, he wants to make sure he has something to hold on to. And also, if it is an option, if the patient has a small 2-pound weight at home to tie around the ankle for a little resistance, that would be great to use as well. And the patient has been advised that he can do 2 sets and 10 repetitions on each leg, and to do this twice a day. And the reason we're doing this is to once again help with the flexion needed in the knee to ascend stairs, and also to be able to bend and use the legs to pick objects off the floor while he's at work. So in just a second, I'll have the patient demonstrate that for you. And what he wants to do is pretty much just bring his knee to a 90-degree angle. And also to give yourself a little bit of a challenge, what you can do when you bring your knee up, hold it for 5 seconds before lowering it back down. And once again, 2 repetitions of those twice a day. The important thing about that exercise, you're doing inner exercises with someone that has a disc pathology or a herniated disc, is to keep the spine as neutral as possible. So that's another reason for using the chair in that technique. As far as the prognosis for our patient, he does seem to be doing well over the 2 weeks that he's been in therapy. So we do expect him to continue to be a candidate for a good candidate for therapy, and to continue to progress. For the knee, whether or not he'll be able to return to his previous level of function, probably not, because those surgeries happened 5 and 10 years ago, and because the medial meniscus has been removed, it's no longer there. So that'll be hard. But what he can do to help that is to just pay attention to good body mechanics and posture, and using those different techniques, so he would decrease injury or any further pain in his back. Also, as far as the prognosis for his back pain, he is doing well with that, and it can take time. It can take for months to years to continue to decrease the herniation in the disc. But once again, that goes back to just making sure you're using good body mechanics, adjusting things with everyday living, such as the type of mattress you sleep on. You will want to sleep on a firm mattress and not a soft one, because that will cause your body to kind of cave and not lay flat. So then you have the spines not neutral anymore, and then the disc can slip and cause those issues again. And also pillows. You don't want to sleep on a whole lot of pillows, because it kind of has the same effect that a soft mattress does. So you want to just limit the pillows when sleeping, and the patient has a great chance of returning to, his everyday living functions and doing exceedingly well. If you have any questions, you know where to find me, my video and discussion board, and I'll be happy to answer anything. Thanks.